Hey everybody, Dr. Butler here. Welcome to our Friday Focus. So I want to send you into the weekend, and by the way, if you don't get this on a Friday, I still want to send you into the weekend with a really important piece of information that I've been sharing with my patients for years and years and years. So the calendar's changing, okay? We're now officially in fall. And fall is all about the environment around us changing. So what we're going to talk about today is one of my personal favorite topics. It's mucus, okay? Mucus. Appropriately behind me is varying shades of green, which will also help to serve as a prop for today's talk. But in all sincerity, what I want to let you know is that we are all conditioned by the media. So when we're watching TV, about a third of all of the TV commercials or the print ads that you see, or the ads that you hear on the radio, are pharmaceutically driven. Okay, pharmaceutically driven. And I just want to draw a distinction for you between what it means to be sick and what it means to actually be healthy but expressing symptoms. So we're all told from a very young age that symptoms are a sign that we're sick. And what I want you to know, I want my patients to know, is that that is not true at all. That our body, when it's healthy, expresses symptoms when it's changing and adapting, and that those symptoms are very good. They're life-saving, in fact. They keep you going. So let's talk a little bit about what it means to be healthy. Okay, so health, right? So right now, the reason we're doing this is why? You're feeling it. Your sinuses are a little congested. You're getting maybe some burning in your chest. You're blowing your nose more. You find it feeling achy maybe. And why is that? Well, health is defined as 100% function of all of your organs and systems, and not the absence of disease or infirmity. So I want you to think about that for a second. When you look up the definition of health, and as a doctor, whether it's me, your medical doctor, your orthopedist, we all study from the same books. When it comes to health, health is defined as 100% function of all of your organs and systems, and not the absence of disease or infirmity. Meaning not the absence of symptoms or sickness. So you can be symptom-free and be very sick. Does that make sense? So we've all heard it. It's sad. We've all heard about, you know, the guy who just was the healthiest guy we knew and dropped dead from a heart attack, or somebody that we thought led a great lifestyle. They did the right things, and yet they were diagnosed with cancer. So never base your health just on symptoms. It is one indicator, but I want you to know a little bit more about symptoms. Symptoms in a healthy way are your body's way to adapt to a changing environment. And so if you think about it, I was just talking to my kids about this this weekend. If you think about it, right now we're going from summer, which is warm and humid, and instead of humid, we'll say moist. It's warm and it's moist, and so what does that do when we're breathing in that air? Okay, it's kind of soothing to the linings of our air passages, which include our noses, our sinuses, our throat, our lungs, all the way down into our lungs. So the humidity in the air is soothing, and it keeps those tissues lubricated. But now the environment is changing, and we're moving into the fall. And our bodies know this, that the air is going to get drier and drier and drier. And so what our bodies are doing right about now is they're going into fall and winter mode. And what they're going to start doing is they're going to start to produce. Produce what? Produce mucus. Why? Your best defense against attack from viruses and bacteria is that you have strong, healthy tissues that form a border between the outside environment, out here, and the inside environment. Those tissues have to maintain their integrity, and they do that by actually staying moist. When your body senses that the air is drying out, it's going to secrete mucus to form a protective layer. So why is it doing that? Well, if the tissues dry up, kind of like your skin when we get into the winter, what do we know about our skin when it gets into the winter? It gets dry, it starts to crack. I mean, I've seen patients who have cracking and bleeding on their skin. The same thing happens inside. The dry air that we're constantly breathing in, we have fireplaces going, we have our heat going, it's constantly drying, taking the moisture away. And just like the Sahara Desert, when there's no water, cracks and fissures appear, and that creates an avenue for bad things like viruses and bacteria to get in. But good news, the good news is your body already knows that. Your body has been doing this for thousands and thousands and thousands, millions of years, who knows, right? But it already knows how to adapt. And so it does that by forming a protective barrier. Now, this is important. The mucus has to be stored somewhere. Okay, so here's a question. What is the purpose of your sinuses? What's the purpose? They're storage vessels. They're areas within your skull that are open cavities to store excess or extra mucus so that as your body calls for it, it can drip down and keep lubricating. Like, think about that. So we're told that sinus pressure and sinus pain is bad and it means that we're sick. And if you have that, you need to take this, this, or this. And what does it do? What does an antihistamine do? It blocks mucus production. Does that make sense? So very often when we're going through these changes in the seasons, we think that we're sick because we've been told that symptoms mean that we're sick. And in reality, the symptoms are nothing more than a sign that your body is actually healthy, right? Because a healthy body functions at 100%. It knows how to defend itself. So what I always tell my patients is, this is your best friend. Okay, your best friend is not loading up on antihistamines and decongestants. Your best friend is the tissue, okay? Because you're allowing your body to produce what it needs to produce to keep you healthy, and you personally are just clearing the passages yourself. By the way, all the research I've done, I do a lot of research, there's no side effects. No side effects to a tissue. So as we go into the winter months, I want you to know that it's not the whole time. You'll notice it usually happens during changes. So during this time of year, kind of started probably 2 weeks ago, and it'll probably go for another 2 to 4 weeks. And then in the winter, you won't have so much of it. Guess what? It's going to come back. It's going to come back when we go from winter to spring. Why? Because our body, again, knows that we're going into a time when there's going to be a lot of particulate matter in the air. All of the flowers are blooming, the trees are creating pollen. And so mucus is also like a fly trap. Okay, it's going to get rid of all the stuff in the air. The last thing I want to touch on is that mucus is one of the very few substances that we as doctors and scientists know on the planet is highly antiviral naturally. So before you pop a decongestant, and I'm not going to tell you not to do anything, but before you do that, I want you to consider this. When a bacteria or a virus, right, viruses are what we're really concerned with, gets into you, and if it hits mucus, it's one of the most highly antiviral substances that we know of on the planet. If you take away the mucus, you're allowing that virus to gain more ground. Okay? The other thing I want you to do, drink more water. Keep everything lubricated. Keep your mucus thin. Make sure you get rest. Okay? You're going to feel more tired and fatigued during these changes in the seasons because your body is expelling a lot of energy to adapt. So get some rest, go to bed early, drink a lot of water, and blow your nose. So that's my tip for the weekend. I hope you have a great weekend. Spread the news. Looking forward to seeing you next week.